Yes, good evening, ladies and gentlemen. Welcome to another episode. I'm not really in a very happy mood while I'm making this video today because we keep losing people, we keep losing health personnel, we keep losing friends, we keep losing our loved ones to some illness, some they are illness that we can actually prevent. Some we cannot do anything about it. They just happen. We just discover it happened, and before you know it, the person is dead. Some diseases that some are just carelessness, some ignorance. But today we'll be discussing a very important topic. It's called stroke. In the local parlance, they call it stroke. In medical terminology, they call it cerebrovascular accident. And so many persons have different opinions about stroke. Some are contrary opinion to orthodox medicine. Some are half truths, while some are totally false and totally lies. So today we'll talk about stroke. Stroke is also known as a cerebrovascular accident. We have different types of stroke. We have the hemorrhagic stroke and the ischemic stroke. I will talk about the ischemic stroke first because this one is very, very common. Sometimes people don't really know what is stroke. They just feel that when someone just sudden loss of consciousness, it's stroke. It's not correct. Seizure, convulsion is actually different from stroke. Now, when there is paralysis or weakness, we call it either hemiplegia or hemiparalysis or inability to talk or inability to swallow. It could be stroke, or the person suddenly lose consciousness. It could be stroke. Sometimes the brain will not get blood supply. As a result, some cells around that part of the brain dies, and it manifests if the part of the brain that is affected controls speech. You see the person will have inability to make speech. If the part of the brain that controls your right part of the body is what is affected, you see that the person will be paralyzed, or there will be weakness in the right side of the body. If the part of the brain that is being affected is the left side that controls the right side, same thing happen. If the part of the body, the part of the brain that controls swallowing is affected, the person cannot swallow. So what actually happens is this: there is reduced blood supply to that part of the brain, and when this happens, the cells around that part of the body, around that brain, dies, and it manifests as cerebrovascular accident. Now we'll briefly talk on the ischemic stroke. Ischemic stroke happens, it can happen suddenly, but most times it happens not when the person is even doing any activity. The person can just be sitting on a sofa and it happens. The person could be reading newspaper, it happens. The person could even be driving, it happens. Now, what are the risk factors that can cause this stroke. There are a lot of risk factors that can cause ischemic stroke. For example, a long-term uncontrolled diabetes, for example, is a risk factor for ischemic stroke. Smoking is a risk factor for ischemic stroke. Or consumption of trans fats, fatty food, sedentary lifestyle, stress. You work more than 8 hours a day could actually predispose you to developing stroke. Uncontrolled, okay, let me leave that for uncontrolled hypertension can cause stroke. But the most common in our environment today, our diet. Many of us we just want to survive because times are hard. Times are so hard that we want to survive, and we must eat. Mankind must eat. So because of this, we will decide to, eat fats that are unhealthy. Some of us will rather, bleach our red oil before we use it to make rice or make stew. We look for very cheap oil that are trans fats. They are so unhealthy, and as you keep consuming these trans fats, some of these cheap vegetable oils, you continue to do what? You continue to accumulate atheromas. You continue to accumulate fats in your bloodstream, in your blood vessels. They keep accumulating, and accumulating. And a time will come whereby this fat that is accumulated will break off, or blood platelets and other blood components will aggregate there and form what we know as thrombus, and it will meander through the blood vessels and get to the brain. When it gets to the brain, it blocks the blood vessels that supply that particular part of the brain it got to. It could be the cerebellum. You see the person will be staggering because blood supply to the cerebellum is no longer is compromised. It results to stroke. This is ischemic stroke or embolic stroke. Some persons, their heart beats so fast. They are candidates of and they call them atrial fibrillation or ventricular fibrillation, though this one kills. But let's say atrial fibrillation, they keep having irregular heartbeats. Sometimes today they feel their heartbeat seriously, tomorrow they will not go see the doctor. They will just say, it's just normal thing. A time will come, if care is not taken, the heart will develop blood clots inside. It will have blood clots inside, and something can happen and it will pump out the blood, the clot inside, and what will happen, it will find its way into the blood vessels. It could block the blood vessels supplying the heart, causing ischemia, myocardial ischemia. It could find its way to the brain and block a vessel and cause what? Stroke, embolic stroke. And when this happens, all the symptoms of stroke will be manifested. So these are some of the reasons why some persons develop ischemic stroke. Sedentary lifestyle. Some of us who don't do anything, we are retired, we just sit watching TV, we sit, put our legs on the table and watch TV. We don't go out, we don't do anything, we just watch, we eat, we don't. This can also is one of the risk factors why you see some of all these retired old men suffer from stroke because of what sedentary lifestyle. They no longer do anything. So it is paramount for you to do what? If you want to prevent, if you want to try as much as possible to prevent ischemic stroke, one, regular exercises, avoid trans fat as much as possible, or if you are diabetic, ensure you see your doctor so that you monitor the progress of your blood sugar control. If you smoke, ensure you reduce your smoking, because it is really difficult to break the addiction of smoking. But sometimes there are other medications that can be used to stop cigarette addiction. If you are an alcoholic, try as much as possible to stop drinking alcohol, especially when you are becoming old. You have crossed 40 years, quit alcohol drinking. Or maybe you are a drinker, you can occasionally you quit all these bad habits. You do your regular exercise. You ensure that you go to the hospital, they check your blood sugar once in a while. But for the hemorrhagic stroke, it is more disastrous. It is most times acute. It is I call it a sudden disaster, because most times it happens when someone is doing activities. You could just be clearing, you could just be driving, you could just be dancing. It happens. Most times the number one risk factor why it happens, uncontrolled hypertension. And because of stress, many of us, we work more than 8 hours a day. We just want to make money. We will not take care of ourselves. We will not even go to the hospital to do checkup. We say, we are fine. Of course we are fine, nothing is wrong. Most stroke patients, they are fine, they look fine, they look okay. If they tell them it will happen to them that very particular day, they will deny it. They always look fine, they always look okay. It just happens suddenly, hemorrhagic stroke. So your blood pressure must be regulated. So the risk factors for hemorrhagic stroke, number one, or hypertension, uncontrolled hypertension, diabetes, cigarette smoking, alcohol drinking, stress level, and all and all. These are the major ones that can cause hemorrhagic stroke. Not just causing hemorrhage, they can also cause, especially the uncontrolled hypertension can also cause myocardial ischemia, myocardial infarction, and cardiac arrest. The person dies immediately. So these reasons why some persons believe that, especially those who are not educated, they believe that stroke is caused by someone throws it. It's an affliction from your enemy. It is not correct. Stroke is not even an idiopathic disease in medicine. Stroke is not even a disease that has defied medical treatments. Stroke is a disease that is pathology, even the risk factor is known. So the survival rate for stroke depends on, as it happens, the time interval for this person to present to the right hospital. It depends. For example, most of the damages that is done, stroke, the paralysis and all, could be reversed if this person is rushed to the hospital within 30 minutes of when you notice, within 30 minutes when it happens. You can't wait for 6 hours or a day and you expect the limbs, the paralysis to return back to normal. No. Immediately it happens, what they do is they rush this patient to the hospital. Not any hospital, a hospital with a doctor. These days, most private hospitals or government hospitals don't have doctors. They only have visiting doctors. So when it happens during the night, they rush them to the hospital. No doctor there, and time is going. Time is going. The time factor, time is going. So this is the reason why when it happens, there are some designated hospitals around you that you yourself know that this hospital have reputable doctors. This hospital is not run by quack. You take this patient to the hospital. And another thing that kills patients fast, when they rush these patients to hospital, they will tell you no injection, don't give them injections. Why won't you give them injections? They will tell you that when you give a stroke patient injections, they die. It is absolutely not correct. If you bring a patient with stroke and he already has, for example, accumulation of blood in the brain, even before you may even do any surgical intervention, you must give some IV fluid to balance the intracranial pressure. To reduce the intracranial pressure, you must give fluid. You must give fluid. And all these, are they not injections? Are they not parenteral injections? So most times, because of the fact that one native doctor have told them that when you give them stroke and give them injection, they die, you see the relative of this patient, they fight with the doctor in the hospital. And as a result of that, this further reduce the prognosis of the stroke patients. Another thing people do that in fact kills the patient most, when they have stroke, they quickly open their mouth, they put spoons inside their mouth, and they even force them to drink water. It has killed so many stroke patients, and then people keep doing this thing. It is very wrong. Most times, one of the symptoms, signs we usually elicit when you bring a stroke patient to us is to elicit what? Swallowing reflex. We try to check if this patient can swallow. If this patient cannot swallow, we pass what? NG tube for this patient. His medications, everything, we use NG tube to feed this patient. While if you force a patient that cannot swallow to take medication, to drink water, that water will go straight to his lungs and the patient will aspirate. It is not the stroke that will kill this patient this time around, but what will kill the patient is what? The water you have forced into his mouth. That will kill the patient. It is called what? Aspiration. Pneumonitis, it depends on what you have forced this person to drink. So all these are some of the reasons why stroke patients dies immediatly. Another serious thing they do, some persons, they will know that this patient probably has blood pressure of 200 and over 100 that caused the stroke. You rush this patient to the hospital. The doctor will not touch that blood pressure. That blood pressure is even a key to his survival this time around. He will not crash his blood pressure. Rather, he will manage the patient around that blood pressure, because there are some other medical reasons why you will not tamper with the blood pressure. But some overzealous quacks, they rush this patient to them instead for them to immediately, this is stroke. What would they do? They will immediately crash the blood pressure of this patient, and the patient dies immediately. So let us know today that stroke is treatable, though it's a very life-threatening disease. It's treatable if this patient is rushed to the hospital within 30 minutes when it happens. Irrespective, wherever it happens, once you notice paralysis, bending of the jaw, angle mouth of the jaw to one direction, or loss of consciousness, you rush this patient to the hospital. Sometimes, if it is so severe, they manage them in the ICU, especially when they've lost consciousness. There are some factors that when we see, we know that this patient has poor prognosis. We know that this patient may not survive. I'm not going to discuss that. I'm only discussing the simple ones. Someone just lapses into unconsciousness, or there's paralysis, or paralysis of either the right part of the or the left part of the body, or there is a sudden very serious headache. Sometimes this headache will be so serious that the person will tell, this is the worst headache I've ever had. It could be what? Subdural hematoma from the stroke. It could be an intracerebral hemorrhages from the stroke. And for us to really determine if this patient is having ischemic or hemorrhagic stroke, you need a CT scan or a MRI, which is very, very unavailable in our hospitals. And this is the reason, one of the most things that you even need to treat a stroke patient, adequately, we lack them in most of our hospitals. As such, patients tend to suffer, and if God be on their side, the doctors could predict this is actually a hemorrhagic stroke or this is actually ischemic stroke, and they manage along that line. The patient do very brilliantly well. So one thing you take from this video today is what? When stroke happens, the first thing you do, take that patient to the hospital immediately. The life depends on the time the patient gets to the hospital. The reversibility of the paralysis from this patient depends on the time you take this patient to the hospital. The more you delay, the more the cells around that brain dies. Within 30 minutes, you get to the hospital. It is a medical emergency. The doctors will start work immediately. Don't ever allow them to delay. Whatsoever will make them delay to manage a patient who has stroke, don't allow it. If it is money that is the problem, you can drop your phone, whatever, but they should commence management immediately. But some patients will have stroke after 3 days. Before they will take this patient to the hospital. What do you want the doctor to do, for crying out loud? It's too late. Sometimes above 6 hours, patient has stroke. After 6 hours, you are taking this patient to the hospital. What do you want the doctor to do? The brain cells are already dead. What do you want the doctor to do, for crying out loud? What do you want the doctor to do? After 6 hours, after 3 days, some after 10 days before they go to the hospital? What do you want the doctor to do? A patient has stroke. You have taken the patient to a chemist. You have taken the patient to a malam. You have taken the patient to a pastor. You have taken the patient around the town before you take the patient to the hospital. What do you want the doctors to do? It's too late. The brain cells are already dead. What do you want them to do? The paralysis likely will be irreversible. What do you want the doctor to do? To avoid all this, yes, it is common amongst the elderly once they are getting aged. It is also common amongst the youth, young age today. 40, 50 years, 35 years, even 30 years, they suffer stroke these days. Even children suffer strokes. We know that times are hard. We know that Nigeria is difficult today. We know that everywhere things are very, very expensive. But please, don't overstress yourself because you want to eat, just because you want to survive. Yes, we must hustle, but don't overstress yourself. Ensure you sleep. Ensure you eat well. Ensure you do your exercises. Ensure you reduce your smoking, your cigarette smoking, your alcohol intake, and don't stop bleaching your red oil before you cook with it. Stop it. And if you see anyone it happens to, maybe the person lapses into unconsciousness, the person is complaining, suddenly start complaining of serious headache, you start prescribing paracetamol because you saw doctor prescribing paracetamol for serious headache, or the doctor prescribed drugs they use to manage migraine for the patient, and you prescribe for the patient. It could be stroke. You can't even tell when, if it is, but if you suspect bizarre symptoms, go to the hospital immediately, because if you don't, the damages may not be reversible. There's another one we call transit ischemic attack. The transit ischemic attack usually resolve on its own within 24 hours. It's a warning. It's a warning that, like stroke, I'm coming back. Get prepared for me. It's a warning when someone has a transit ischemic attack. It has all the symptoms of stroke, but the person will recover within 24 hours. The person will live normally again. It is a warning. It's like God has given you a second chance to live. It's a warning that you must take all precautions. Thank you so much for your attention, and let's try as much as possible to always check our blood pressure. Let's try as much as possible to not to live a sedentary lifestyle. Let's try as much as possible to avoid oils that contains trans fat. Whenever you want to buy your vegetable oil, take the can, read what they wrote on. You will see them trans fat, how many percentage, fatty or acid, how many percentage. You read them, and you take and you choose among them. If you can't and you have the financial means, I will encourage you to use olive oil instead. Olive oil, very, very good for cardiac problems, for cardiac diseases. Very good, very, very good. Because of what it contains, what is very rich in omega-3 fatty acids. So also fish oil. Your fish is also very rich in omega-3 fatty acid. I used to tell all my patients who are above 40 years to stop eating beef, chicken, and if they can, they should concentrate on good fish. Fish are even more expensive than even meat, beef, and chicken, because of what it is rich in omega-3 fatty acids. It helps to build your high density lipoproteins and reduce your low density lipoproteins. Your high density lipoproteins is very healthy, while the low density lipoprotein it's the one that is a potential to cause atherosclerosis, to block your blood vessels. Thank you so much for your attention, and we see you again in our next episode. Thank you. Bye bye.